Well, Fox News Alert, we are getting reports from Washington. The House Democrats are looking at very big health care changes, including federal aid to families making under $88,000 a year to help pay for health insurance. Now, the Associated Press is also reporting that it has a copy of a plan that shows the feds developing an insurance program that will compete with private companies. Besides costing American taxpayers trillions of dollars, what can you expect as Washington pushes to reform our health care system? Well, our next guest has a few ideas on it. He's Dr. Mark Siegel. You know him well. He's a Fox News medical contributor. Doctor, good morning.
Morning, Megan.
I'll look at your points of what we can expect if, in fact, the government gets more involved in health care under these plans, Barack Obama's plan or these lawmakers' plans, and I feel a little depressed. You are not forecasting good things, first, when it comes to costs.
Well, I got to tell you, Megan, I want to say one good thing. We have currently the best health care in the world. I'm convinced of that. We have high technology. We can offer treatments that no one else can. That's why people come across the borders here from Canada.
Yeah.
I don't want to see that sacrificed. I don't want to see it diluted. I'm a practicing primary care physician. Our group is in trouble. His plan, Obama's plan, and what's being pushed through the House has an idea in mind that I'm concerned about. They seem to think that prevention is key, but primary doctors, internists, and general practitioners are running away. Where are we going to get the doctors that are going to take care of this big load of patients? It's a mandatory system. They're talking about mandating health care. Everyone's going to have to sign up. But just because you have insurance doesn't mean you're going to get care if there are not the doctors to take care of you.
Well,
doctors are already
overwhelmed. But he's going to spend all of our taxpayer money trying to fund this program, so won't that pay for you doctors?
Well, it's going to pay for something. I think it's going to pay for MRIs, and it's going to pay for more and more technology, and it's going to pay for insurance companies and maybe prescription drugs. Doctors are going to get under the bus here, for sure. Reimbursements to doctors are going to be cut. Reimbursements to hospitals are going to be cut. I'll tell you, I'm actually worried about that, too, because the Medicaid dollars that goes to hospitals, there's networks within hospitals to take care of Medicaid patients. Private physicians are not really set up to do that. If you keep cutting hospitals, you're not going to be able to take care of our poorest and sickest patients.
And what a lot of people don't realize right now is you think somebody's a doctor, you think, oh, he or she, they must be rich. Doctors are not rich. Very few doctors are making a lot of money these days because of these cutbacks in insurance already that you're dealing with. Primary care physicians, with all due respect to my guests, don't make a lot of dough. They do it because they want to help people. So you can't afford to have costs cut at the moment.
Oh, and so you're going to mandate electronic medical records. You're going to have more and more paperwork. You're going to have them seeing more and more patients. Primary care doctors, and I should tell people out there, they're already seeing too many patients. You know it. You've been waiting in waiting rooms. The wait in waiting rooms is going to get longer. So before we hastily pass all of this, I am not, forecasting doom and gloom. I want us to be out in front of this, and let's talk about the real questions. Let's get the system reoriented towards prevention. Get more primary care doctors, give them incentives, get more of them in medical school to go into primary care.
You talk about the waiting list. A lot of people have suggested that if we go down this path, we're going to look a little bit more like Canada than perhaps we want to when it comes to health care. In Canada, the waiting list for GYN surgery is 12 weeks. For cataract removal, 12 to 18 weeks. For a tonsillectomy, it can be up to 36 weeks. For neurosurgery, it can be up to 30 weeks. You have to wait under their system, which people think he's pushing us closer to. I want to ask you, are we going to be seeing those kind of waits, and are we going to be seeing a decrease in the level of care?
You know, that's a great point, Megan. I'm glad you got to that. Yes, we're going to be seeing those waits. More importantly, Americans pride ourselves at having access. We like freedom here. We're not going to be able to get our liver transplants when we're 60 years old. We're not going to be able to get our pacemakers when we're 90 years old. We're not going to be able to have dialysis if we need it. Because if there's a government plan, a public option, it's going to mean rationed care. The government is not going to approve all of that because they're going to say it's too expensive. Insurance companies are going to have to compete with the government, so they're not going to be able to approve that. You know, for a private insurance company, the bottom line is profit. They have to be able to make a profit. If they're competing with a big government giant, they're going to cut out services too in order to ensure that profit. Rationed care is a way to make a profit, but it's also a way to exclude necessary care from people that really need it. Americans want to be able to have their dialysis and their pacemakers if they need them.
And their tonsillectomies and their neurosurgery.
And not wait 6 weeks. Where are we going to go? They're already coming across the border here. Where are we going to go?
Good question. Dr. Mark Siegel, thank you so much for